Welcome back to CANCERBUZZ TV. I'm your host, Summer Johnson. This is the second episode of a 4-part series on myeloproliferative neoplasms, or MPNs. MPNs can develop aggressively and be a precursor to more serious diseases, so it's important patients receive timely treatment. Today we're looking at best practices and therapeutic considerations for these patients. Our guest is Dr. Srdan Verstovsek, professor of medicine and hematologist-oncologist at MD Anderson Cancer Center. Thank you for joining us again on the show. Can you tell us about MPNs and how they present in patients?
So MPN, or myeloproliferative neoplasms, are a group of diseases of the bone marrow and blood where cells grow without control. So many patients have too many red blood cells, or too many white cells, or too many platelets, the three main types of cells in the blood. But some, and that one is different than others, have a fibrosis development in the bone marrow, like a scar tissue, which limits the growth of the cells. In fact, many patients then present with the too few cells in the blood, and that myeloproliferative neoplasms is called myelofibrosis. This is the most aggressive one. People suffer from anemia, from low platelets, may have a low white cell count, and the body reacts to it by increasing the organs that potentially make some blood. So about 80 to 90% of patients have very big spleen, about 20 times normal size. About half of the patients may have a very big liver. And these patients suffer from general systemic symptoms: night sweating, low-grade fevers, itching, bone aches and pains, cachexia, weight loss, decreased performance status. So in myelofibrosis patients in particular, for which we are concerned so much, we identify 3 areas of concern: failing bone marrow production of the cells, anemia particularly is a problem, very enlarged organs, splenomegaly, which may be very symptomatic, and general systemic symptoms, as I mentioned, area of concern number 3. So these are the 3 areas where we try to help the patients with prescribing them some new medications to counteract those problems.
Can you explain why early intervention is so critical for this patient population?
As we identify the patients with myelofibrosis, we would like to objectivize those problems: how bad anemia is, how big the spleen is, how bad the quality of life is. And knowing that quality of life is in the eye of the physician and the patient the most important factor, which it's common sense, right? You want to make people feel better and live longer. You want to first objectivize that measure by applying, for example, MPN 10, which is a questionnaire to know how bad the quality of life is. So you have then a better perception of what the problem is. You know how objectively that quality of life is. You know how bad the spleen is, how bad the production of the blood cell is. And we learn from experience of the last 10 to 20 years that earlier intervention, when the things are not too bad, will actually help us achieve the goals of therapy. We will have a chance to significantly more decrease the size of the spleen or improve quality of life if we do not wait for patients to be terribly sick. So earlier intervention in terms of identifying the problem, objectivizing it, and saying, hey, that quality of life is already so bad. Look, that questionnaire tells me that the symptoms are there. I should start therapy now. Why wait?
How important is it for the multidisciplinary team to use shared decision-making with patients?
You recognize that these are after all chronic conditions and people have time to live with it. And we try to control the signs and symptoms and make them live longer. So it is engagement of the whole team, from the nurse to physician assistant, nurse practitioner, and the actual doctor, to get together and provide the optimal care for involved patient, whether he or she comes from far away from the nearby of the cancer center where we work. The same approach applies, and engagement with the local doctor, who may or may not be expert in therapy of myeloproliferative neoplasms, will further enhance the care provided to that particular person affected by MPN. Along those lines of a team effort, the most important participant to me is the patient, him or herself. Education on the patient part about the need for filling up the MPN 10 questionnaire, for example, to give us the knowledge how bad the quality of us are, and to follow on the path forward when we prescribe certain medications, so that we follow and adjust the medications dose properly, so that we don't have people not showing up for a follow-up. Because all of these little things are so important to get the best out of the therapies. We cannot really cure patients with medications we have, but we can provide a really good control of the signs and symptoms if it's provided in an optimal way, where the participation of patients and knowledge on part of the patients is critical as well.
Thank you, Dr. Verstovsek. You can head to the show notes if you'd like to learn more about MPNs and treatments available. Keep your eye on this channel for the next episode in our 4-part series on MPNs. CANCERBUZZ TV is a resource of the Association of Community Cancer Centers for busy cancer care professionals. Today's show was made possible through support by Insight. On behalf of all of us here at CANCERBUZZ TV, thank you for watching. I'm Summer Johnson.